Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
Welcome to Ask the Doc. I'm Olga Villaverde. We take your heart health very seriously. And today we're talking about cardiology medications. Whether you're managing high blood pressure like me, dealing with cholesterol issues, or working to keep your diabetes under tight control, we're here to give you all the information about your medications. So with us today, we have the dream team, Dr. Madeline Camejo, Chief Pharmacy Officer for Baptist Health, and also joining us, Dr. Amanda Gronniger, a pharmacy clinical specialist for cardiology at Baptist Health. They're here to answer all your questions on this episode of Ask the Doc. Welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. So let's get to that first question. And it is from Chalo. She's reaching out from allhealthtv.com, which you should check out. We've got so much information on allhealthtv.com. So let's see what Chalo writes. She tells us, ¿Cómo estás, Dr. Camejo? I was recently diagnosed with high cholesterol, which I know is not a good thing. But if I'm being honest, I really have no idea what cholesterol is or how this medication I'm taking actually works. Dr. Camejo, I love this question because I'm asked this a lot of time about the HDL, LDL. So please inform our viewers about cholesterol.
So Chalo, I'm so happy you're asking me this question because knowledge is power. So knowing your cholesterol numbers, I think, is a good place to start. And mostly, if you want to look at total cholesterol, most people should try to keep their total cholesterol below 200 milligrams per deciliter. And your LDL, what they call the low density lipoprotein cholesterol, aim as this is the bad cholesterol. You need to try to keep this one under at least 100 milligrams per deciliter. So as is said in the video, high cholesterol means there is too much cholesterol particles circulating in your bloodstream, and cholesterol can stick together, causing plaque to build up in your arteries, blocking blood flow. So this is what leads to heart attacks and strokes. And statins like atorvastatin or pravastatin and simvastatin are types of medication that can help reduce the amount of cholesterol in your blood. And they usually work by blocking an enzyme in the liver that is used to produce cholesterol. So therefore, statins really help to reduce the amount of cholesterol that is produced and helps remove the cholesterol from the blood. Lowering cholesterol isn't the only benefit of taking a statin. These medications have been linked to really lowering the risk of heart disease and stroke by reducing the risk of certain blood clots and stabilizing plaque buildup. Therefore, this is why they help reduce heart attacks and stroke.
Thank you so much, Dr. Camejo. Let's go now to Mitzi. She sent a question through YouTube, and here's her question to us today on Ask the Doc. Mitzi writes, "Hello, doctor. I have a difficult relationship with a family member, and I think it's affecting my health. I got dizzy the last time she stopped by, and as a result, I went to my cardiologist who told me I have high blood pressure. He prescribed a medication called a beta blocker. What's a beta blocker, and what does it do?" So Dr. Gronniger, I'm going to turn this one to you. I'm actually not on a beta blocker, but I do have controlled blood pressure today.
Hi, Mitzi. Thanks for sharing your story with us. Happy to explain what beta blockers are and how they work. Beta blockers, such as carvedilol and metoprolol, are types of medications that help lower blood pressure and control heart rate. They work by blocking epinephrine, also known as adrenaline, which can elevate blood pressure and heart rate. By causing the heart to beat more slowly and with less force, these medications help reduce blood pressure. Additionally, they can enhance blood flow by widening veins and arteries. Some possible side effects of beta blockers can include fatigue, dizziness, dry mouth or eyes, nausea, or lightheadedness. But some of these side effects can lessen or disappear as you keep taking the medication and as your body gets accustomed to the dosage.
Thank you so much, Dr. Gronniger. Got a question here, Dr. Camejo. This one's from Facebook, and it's Darnell. This is the question that they write. Dr. Camejo, my mom and pops have passed away in their 60s from heart problems. I'm so sorry, Darnell. which is why I bought a home blood pressure monitor. I checked my blood pressure and it was 140/85, which I guess is kind of high. I went to my primary care doc and she put me on an ACE inhibitor. Can you please tell me what that is and how it works, please? And doctor, I would also love for you to talk about what's the new norm in terms of what is a good number. Before it was like 120/80, and I'm not sure if that's changed.
It's still the same. It hasn't changed at all.
Great to know.
So ACE inhibitors like captopril or enalapril, those are classes of medications that help relax the veins and arteries to lower your blood pressure and are always the first line of medications that are used to lower blood pressure today. You know, we have enzymes in our bodies that are called angiotensin II that narrow blood vessels and cause the heart to work harder, and that's what increases blood pressure. So ACE inhibitors actually block our bodies from making those angiotensin II, which allows our blood vessels to relax and improve blood flow, therefore lowering your blood pressure. So that you're aware, if you are put on an ACE inhibitor, you know, some of the side effects of an ACE inhibitor may include dry cough, extreme tiredness, dizziness from low blood pressure going too low, headaches, loss of taste, and it does elevate your potassium in the blood. So avoid potassium-rich foods like bananas, avocados, tomatoes. They can cause very high levels of potassium in your system, which could also lead to heart arrhythmias.
And Dr. Camejo, I wanted to actually just show Darnell, because I'm an advocate too. This is actually my blood pressure machine. This is what I use here at home. And I would love for you to answer this question, because I get this from a lot of people. You know, when do I take it? Sometimes people take it too much. Should it be the same time every day? So for Darnell and those that advocate for ourselves, what would you recommend for the blood pressure machine?
For the blood pressure machine, I think you should take it at least twice a day, once in the morning and also in the evening, and keep a log. I think it's important. When you're first starting, you may want to do once in the morning, once in the afternoon, once in the evening to see how your blood pressure actually fluctuates throughout the day. And then that's an important, as you log that, you can take it to your provider and they can help you then adjust to your medications.
Perfect. And I always tell my friends, be careful you don't see George Clooney, because then you can really hit like 150/100. Thank you, Dr. Camejo. A question in from Logan, and Instagram is making an appearance here. Thank you, Logan. Let's see what their concern is. I used to be a great walker. I walked everywhere and loved it. But then I started getting a lot of cramping in my legs. I went to my doctor and he diagnosed me with atherosclerosis and peripheral artery disease and prescribed some medications. Can you tell me more about how these can help me? So Dr. Gronniger, what are your thoughts here with this question?
Thank you, Olga. So Logan, you have really good questions. So arteriosclerosis is a broad term that describes multiple conditions that can lead to the thickening and reduced flexibility of our arteries. Atherosclerosis is a type of arteriosclerosis that develops when we have plaque buildup in our arteries. So medications that can help this in PAD include statins, blood pressure medications, and blood thinners such as antiplatelet medications. So statins, as Dr. Camejo mentioned earlier, can help stabilize the plaque buildup and prevent more plaque from forming in our arteries. Antiplatelet medications such as aspirin and Plavix help to prevent platelets from sticking together and causing clots. All these medications can work together to help prevent a heart attack or stroke.
Thank you so much, Doctor. Our next question is coming in from YouTube, and this question comes to us from Juanita. Let's see what she writes to us on Ask the Doc. Dr. Camejo, I've been having some heart issues, so my cardiologist told me to watch my salt intake. Oh, do I like this question? And begin taking a diuretic. I'd like to know what a diuretic does and how it can help my heart. And Dr. Camejo, I would love for you to talk about the salt intake, because I love eating arroz con huevo fritos, right? Rice and eggs with a lot of salt on top.
So sure, Juanita, thanks for your question, and we truly appreciate it. Now, diuretics are also known as the water pill. You know, everyone used to take them just to think that they could lose weight and lose that water. But high salt intake can lead to water retention in our bodies. So this is why salt intake should be monitored, especially if you have heart disease. Too much water and fluid, it could put a lot of stress on your heart. So diuretics can really help remove that excessive water in our body and help lower blood pressure. They work by helping that kidney remove the water and salt from our bodies. And due to this, it will lead to more urination. And the more you urinate, the more your kidneys will flush out salt and water. So this will also help your heart make it easier to pump blood throughout your body. And when taking a when taking a diuretic, it's important that you know when you need to take them. For example, it's best to take them in the morning, as you know, they cause increased urination throughout the day. And if you take them at night, you'll be up, waking, and going to the bathroom constantly and not have a good night's sleep. Now, diuretics can be very helpful for heart problems, but they can also produce some uncomfortable side effects. And let's discuss what those are. So potential side effects for diuretics are: number 1, headaches; 2, fatigue; 3, urinary frequency; 4, dizziness; and 5, nausea. Back to you, Olga.
All right, Dr. Camejo, thank you so much. And that salt intake, by the way?
Depends on how your heart condition is. Now, if you have a good heart, you can eat your salt, but be careful. You don't want to retain a lot of water.
I have cut back. I will say that, but I still like to put a little bit on there. Thank you, Dr. Camejo, very much. Okay, we have a Facebook question now. Dr. Camejo, this is actually for you from Asher. So let's see what they write. Hi, Dr. Camejo. My husband was recently diagnosed with angina, and he was prescribed nitroglycerin pills, which made us both very unhappy because his doctor told him he could no longer take his other favorite pill, Viagra. Why not? All right, well, this is a pickle. We need to fix this.
So, Olga, it's not just Viagra, but there is a certain category of meds that is for ED, erectile dysfunction medications that do interfere with nitroglycerin. So what happens is when you take nitroglycerin with a medication like Viagra, it can lead to dangerous drops in blood pressure, which could be fatal. So it causes this big drop in blood pressure because both medications cause the blood vessels to really relax and open wide. So it can be too much when taken together. So my suggestion is you need to stop taking the nitroglycerin at least 24 hours prior to taking the Viagra. And remember that nitrates and Viagra don't mix well.
All right, Dr. Gronniger, we have a question from Instagram, and this one is from Debbie. So let's see what she has to write to us. Dr. Gronniger, my cardiologist wants to prescribe GLP-1s for me, which I found out are those new injectable weight loss medications. I'd love to lose a few pounds, sure, but I thought these meds were specifically for diabetics. Great question there, Dr. Gronniger.
Thank you, Debbie, for reaching out to us and sharing your story. So you are correct. These medications were developed originally to help patients with diabetes. However, after they were studied and used by patients, they discovered that they also help with not only weight loss, but also with heart protection. So just this year, 2 of these medications, Wegovy and Ozempic, were studied for patients with cardiology issues, and they were found to reduce the risk of major cardiac events such as heart attacks and strokes. So in addition to weight loss, they can help improve blood pressure and also can help prevent repeat heart attacks or strokes.
Thank you so much, Doctor. Appreciate the information. All right, the next question again from YouTube, and this one is from Takashi. And let's see what her question is to us. Hey, Doc, I had a mini stroke recently, and in addition to many other medicines, they put me on something called Plavix, which is supposed to stop clotting. I'm concerned about getting into an accident or something and my blood not being able to clot. That could be really dangerous. Dr. Camejo, this is a very good question, and I believe the answer is yes, that could be very dangerous.
Well, of course. And Tashi, it could be very scary recovering from a mini stroke, but the human body has a lot of moving parts and processes, and your doctors are giving you the medications that are going to help you stay on the road to full recovery. But I'm going to ask Dr. Gronniger, who I know sees many patients in her clinic, with this, and what advice would she give to you?
Thank you, Dr. Camejo. So when a medication is prescribed, we always look at risk versus benefit. So in this case, your doctor probably thought you were at a greater risk of more strokes than having a serious accident from the medication. When you've had one stroke, you're at greater risk for having more. So you are correct. Plavix does help thin out the blood. So you should be careful and not climb any ladders. If you fall and hit your head, it is important to go to the ER just to make sure that everything is okay. However, Plavix has been around for a long time and has been proven to be safe and effective at preventing further strokes.
All right, we're going to head to allhealthtv.com, a great source of information for our viewers. Again, allhealthtv.com. And this question is from Carl and Dr. Camejo. It's for you. Hi, Dr. Camejo. What over-the-counter medications should you avoid when taking prescription cardiology medications? I love this question because since I take a blood pressure medication, valsartan, to be specific, I'm always wondering what over-the-counter can I take. So I'm so grateful for Carl's question.
So Carl and Olga, absolutely. Thanks for reaching out. One of the things you need to understand is that when you're taking prescription meds, it doesn't matter, even cardiology meds, it's always important to be aware of potential side effects or interactions that are also with other medications as well as over-the-counter meds. So there are several over-the-counter meds if you're on a cardiology med to avoid. Number one would be NSAIDs. NSAIDs are like your Aleve, your Advil. They increase blood pressure, so the risk of heart attack and stroke kind of stops the effect of the medication. The other one is decongestant. Decongestants also raise your blood pressure and heart rate. Antihistamines like Benadryl, they cause drowsiness and may affect heart rate and your blood pressure. Now, cold and cough medications like Robitussin also have a stimulant effect that leads to a higher rate in your heart, as well as blood pressure. I would say 5 herbal supplements like ginseng. Herbal supplements can affect these effectiveness and cause also adverse side effects. And Lasix and diuretics and laxatives, like Dulcolax, they can lead to dehydration, which it also affects heart function, and they can interact with heart medications. Now, if you do have a cold or any kind of cold symptom that you feel you need to decongest, talk to the pharmacist because there are some medications that you can take that don't have the ingredients that would affect your heart and blood pressure, and they're usually out on the counter. You can talk to one of your pharmacists to help you with that.
And Dr. Camejo, I really do try to stay away from Advil for the reasons you just said right now. But if someone's not feeling very well, a little achy, maybe they worked out too much, Tylenol?
Tylenol. Yeah, I would go with Tylenol. Oh, Tylenol is always a good one.
That's what I figured, but in case somebody's wondering, I wanted you to say it, not me. Thank you so much, doctor. All right, let's turn to Facebook right now. We have a question from Lavar, and this is the question they ask. What are the considerations when prescribing medications for patients with both diabetes and heart disease? Dr. Gronniger, can you take that one for me?
Yes, great question, LeVar. So it is common for patients to have both diabetes and heart disease, and some of the medications that were developed for diabetes have also been shown to help protect the heart. So there are some medications now, such as Farxiga and Jardiance, that can be prescribed for heart disease, whether a patient has diabetes or not. But on the contrary, there are some diabetes medications that can also be harmful for the heart. So if you have certain heart conditions, such as heart failure. So it is very important that all of your doctors know that if you have heart disease and diabetes, so they know which meds can help you and which ones you should avoid.
Fantastic. I have a few more questions and we still have a few more minutes. So let's keep going because this is great. Akiko is writing from YouTube, and this is their question to you, Dr. Camejo. Hi, Dr. Camejo. Could you discuss the use of calcium channel blockers in treating heart conditions?
So sure. Thank you for your question, Akiko. And there are many calcium channel blockers, and they have different indications. All of them, block calcium, which enter the cells into the heart and blood vessels. And this is important because calcium can cause the heart and blood vessels to work harder by squeezing harder. So when you block the calcium, then it allows the blood vessel to relax, widen, and help reduce blood pressure. Now, medications such as amlodipine and nifedipine are very effective at lowering the blood pressure. Now, other calcium channel blockers such as diltiazem and verapamil are more effective at controlling your heart rate in conditions such as atrial fibrillation. And now some side effects of these calcium channel blockers are swelling of the feet and lower legs, constipation, headache, dizziness, and fatigue, and nausea as always. But just make sure that you are taking your medications because it's important to have good blood pressure and make sure your heart is working well.
Let's turn it back to allhealthtv.com. And we've got a question from Liam. And Dr. Camejo, this question is for you. So stand by for the question. And here we go. Dr. Camejo, what are the benefits and risks associated with angiotensin converting enzyme, ACE inhibitors?
ACE inhibitors. So ACE inhibitors like lisinopril, benezabril, are very effective at lowering blood pressure. And although they have some side effects with them, they are a very common use, like we discussed earlier, is that dry cough. Everybody who's on an ACE inhibitor will always go away with the dry cough. So make sure that ACE inhibitors can also affect the kidney function and electrolytes such as potassium. So it's important to stay hydrated. Watch your potassium intake. Remember, we talked about that in one of the earlier questions. And usually your doctor will check your kidney functions and potassium level 1 or 2 months after you start an ACE inhibitor. So it's important to always go back to your doctor. Make sure that once you're put on any of these medications, go back 4 weeks, 6 weeks, and make sure that all your labs are taken and making sure that all of these potassiums and your kidney functions are working the way they should be.
Dr. Gronniger, we have about a minute 30 left. And I just wanted to ask you a personal question. And it's one that I get a lot from my friends. At 50, I actually was diagnosed with high blood pressure. I was very surprised. I eat well, I exercise, I'm thin. So sometimes there's a genetic disposition. That's my first question. And my second question is, once on a blood pressure medication, always, TID till I die? I mean, I hate to be morbid there, but yeah.
That's a great question. So as you mentioned, a lot of times it is genetic. However, it doesn't always mean you're going to always have to be on a blood pressure medication. Now, we always look at other factors. Weight loss can help a lot with blood pressure, as well as salt intake, as we mentioned. And also alcohol can help a lot too. And then there's other disease states that can worsen blood pressure, such as sleep apnea. So just because you get put on a blood pressure medication does not mean you're always going to be on it. We like to address those other issues to help with your blood pressure.
Fantastic. Thank you, ladies, so much for the opportunity to have these questions answered. You are the experts, and we do appreciate your time. I think the most important message here is to know your numbers, and like we've got from so many viewers who are advocates for themselves. So thank you, Dr. Camejo. Thank you, Dr. Gronniger, for your time. I appreciate it very much.
Thank you.
And as always, thank you for sending in your questions. We love to answer them. Stay tuned for more episodes of Ask the Doc. I'm Olga Villaverde, and remember, take care of yourself, know your numbers, and be healthy. Have a great day.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.